Hi everybody, I'm Ashley Oswald, a functional medicine dietitian, and I'm excited to get to talk with you today about functional medicine and what it is. So functional medicine was career changing for me. It's been life changing for my clients. I've been a dietitian since 2012 and really got into functional medicine about 2014, 2015. I was living out in California. I started working with a couple MDs in their functional medicine practice, learned so much, took a 2-year online course similar to what you're taking, and then started a digestive clinic in 2016 where we're getting to honestly change people's lives. And I have some stories that I'm going to get to share with you in this presentation, and I'm going to also share some tips and tools that we use at our clinic on top of the foundation of, how does functional medicine really differ from the current medical system? And there's a lot more overlap than people think. So let's try to clarify some of that today. Let's start out by just saying that in the beginner's mind, there are many possibilities. In the expert's mind, there are few. And I love this quote to start out because some of you might be coming from being a doctor. You went all the way through medical school. Now it's like, oh my gosh, I'm now taking more school, right? On things that I didn't learn in medical school, because on average, most physicians have less than 20 hours of schooling in nutrition science. But as you'll see in the upcoming slides, chronic disease is a huge issue in this country, and really nutrition and lifestyle medicine is what we need to truly help people improve their health in that manner. Or you might have been practicing as a nurse for many years, so this almost feels like a little career change inside this medical field. And I know because I was there and I was conventionally trained, and through that training I was made to feel like I know everything. I almost got this ego, right? And I had to really set that aside to open my mind to new possibilities of this knowledge that I didn't quite have yet. So that's why I wanted to include that slide. And then here you'll see mortality in the United States from 2018 and the top 10 leading causes of death, which I alluded to in the last slide. Are many of these, at least they're preventable using different nutrition lifestyle modalities, or we can at least significantly improve them. So heart disease and different cancers and respiratory diseases, stroke, Alzheimer's disease, which is being called type 3 diabetes, and diabetes, type 2 diabetes. The functional medicine practice I worked at in California, we had a whole Help Your Diabetes program, and we were seeing people reverse their type 2 diabetes within a few days of making changes. There are some who are able to cut their insulin in half. So it's really quite amazing. Kidney disease can be a downstream negative effect from diabetes, and suicide. We're even learning a lot about this gut-brain connection and how we can help people improve these chronic mental health conditions using functional medicine. So it's very, very exciting. And here is a paper by Elizabeth Bohem, and she states, nutrition is one of the most powerful interventions available. In many cases, it is less expensive, safer, and more effective than reaching for medication to relieve every symptom. Optimal nutrition interventions to both prevent and treat disease can help patients reach the highest expression of their health. And that's certainly what I've seen in my time as a dietitian in functional medicine and at our clinic. And a lot of times it's just weighing the potential benefits to the potential risks, because as you'll come to learn, there's a lot of flaws in research, and it's difficult to research different nutrition interventions, because if you think about it, if you're going to be doing a randomized control trial, keeping all the variables the same and changing one thing, when you're talking about somebody's lifestyle and somebody's diet, it's really difficult to get 100 people to do everything exactly the same for their health and then change one component to properly research it. So we want to always weigh potential benefits to potential risks, and using the N=1 study, like case reports of our clients, right? When we do that, when we say, hey, this person's eating the standard American diet, let's first start with cleaning that up, getting them in more nutrient-rich foods, eating the way that we were eating 100 years ago before we started to have so much chronic disease. And let's look at that individual person and see how their symptoms improve, and then go from there. Is this N=1 study approach in functional medicine. And I also have my own story I want to share with you. I, at the age of 11, started to have severe acne for 10 plus years, honestly, if I think about it. Mid-college. And it was to the point where my dermatologist didn't know what else to do. They wanted to cycle through more medications. I even went on Accutane, and it didn't fully work, even though it was just an awful experience. Embarrassing, really challenging going through middle school and high school, and then finally come to functional medicine, and it worked. I don't wear makeup anymore. It's really amazing. Also from the perspective of all those antibiotics ruined my gut, and I was having like gut pain and bloating and all these issues during college classes. And so to be able to now tolerate pretty much every food, not have those gut symptoms, not have to deal with diarrhea every day, have a clear skin, it's just remarkable how the body can heal if we give it the right tools to do so. And that's what functional medicine is all about. So today we're going to talk about what is functional medicine. I'm going to share some functional versus conventional case studies to help you kind of get an idea of how does this actually look in a client case. If somebody comes into me with constipation, I'm used to doing like recommending more water, more fiber, maybe medication. What is the functional medicine options for that? And so we'll do 2 examples of that. I'm going to share with you some useful clinician tools that we use in our clinic, some ODC, Oswald Digestive Clinic client stories to help give you some motivation and excitement for this field, and then next steps. And I will say, honestly, I maybe would have stopped being a dietitian altogether if it weren't for functional medicine. Because some of those old ways that I was taught originally, in 2007 and on during college, like counting calories, like low fat for a lot of things, it just didn't make sense. So this whole food as medicine approach is just makes so much more intuitive sense, and it works. It works a lot better. So what is functional medicine? Functional medicine is also known as functional nutrition, food as medicine, integrative nutrition, integrative medicine, alternative nutrition medicine, root cause nutrition medicine, lifestyle medicine, and maybe like each person has slightly different ideas as to what these different terms mean, but ultimately what I'm trying to get across in this slide is to let you know there's really not a standard definition for, if you do food as medicine, you are called functional medicine. There's a lot of overlap, as I was discussing earlier, and I was actually working at Regents Hospital for many years. I spent a good chunk of my career there. And it must have been 2017, they had a group of doctors discussing functional medicine because patients and clients were asking for it. And, I think clinicians are starting to realize this whole world that works better for clients. And so they're discussing how do we maybe start bringing functional medicine into this health partner system. And what I had been told is that they were hung up on the definition of functional medicine. You all don't get hung up on exactly what functional medicine is. Get hung up on the practice of it, because you will see the results coming out of clients, and you can call it whatever you want to call it, but what matters the most is that we're helping people. We're being clinicians in the way that we originally intended and wanted to be. And so if you call yourself an alternative nutrition practitioner, a root cause medicine doctor, it all kind of is a wash in that sense, if I'm making sense there. But yes, so that we're all clear, all these terms are often intertwined and interused. So what is functional medicine then? The Institute for Functional Medicine has this really great graphic, and what I think of it at the end of the day is root cause. We're looking to get to the root cause of disease, improve that, and then allow the body to improve all these symptoms that are maybe coming about because of that root cause issue. So one example, I was just filming a TikTok video, and we were talking about constipation. So constipation, you may or may not know, but celiac disease can actually present as constipation in about 1/5 of people. And so if we're sitting there and telling a patient, eat more fiber, drink more water, and you're still constipated because you're not eating enough fiber still, you need to drink more water even, because if you just drank more, you wouldn't be constipated. And believe it or not, like, patients are told things like this, and they're like, I am, and it's not working, but you're not doing it well enough. Anyway, long story short, there might be other root causes that are just being missed because the practitioner hadn't been taught that in their original schooling. So that's what functional medicine is all about. It's all about teaching all those other possible root causes to different symptoms, and just seeing these diseases, like you see on the top of here, this iceberg, arthritis, cancer, diabetes, as, maybe just see them as symptoms and what's causing that. It's not just, this person happened to get diabetes. It's the question of what's out of balance in the body causing that diabetes. And certainly type 1 is different than type 2, but if it's type 2, is their body just not able to handle the amount of sugars and carbohydrates that's coming in? And maybe if we decrease that burden, the diabetes can improve or even reverse. So then we go here, the whole under iceberg here of the underlying causes: inflammatory imbalances, hormone imbalances, detoxification imbalances, structural imbalances, immune, mitochondria, digestive, absorptive, microbiological, toxic chemical exposure, even like mercury fillings and things that we maybe used to think are benign. Now we know they really aren't. Even emotions, right? And so functional medicine is a personalized, systems-oriented model that empowers patients and practitioners to achieve the highest expression of health by working in collaboration to address the underlying causes of disease. Okay, we're going to come back to this a little later on when talking about the case studies. And here's just another way of showing this functional medicine tree, or the iceberg, kind of the same idea where we have all these organ system diagnoses up here, signs and symptoms, but then we get down to the roots. What of these categories are out of alignment for this person? And what this is showing too is that you can have two people with the same symptom up here, same issue, same category, maybe it's gastroenterology, maybe it's like diarrhea, but when we come down to the roots, for those two individuals, the root cause might be different for them as to what's causing their diarrhea. So really, this case study approach, N=1 approach in functional medicine, is so key because of this reality. So functional medicine uses food to improve and prevent disease. Food is information, not just calories. And I love that switch in brain thinking to food. It's information telling your body, helping support different processes in our body. It acknowledges biochemical individuality, incorporates a patient-centered approach, focuses on the whole person, mind, body, spirit, informed by evidence-based research. And this is the biggest, it's the biggest confusion for functional medicine is people think it's not evidence-based, and they're still floating around the internet saying that too, saying it's woo, but it really is. It's really exciting when you look at the research that you maybe just weren't shown because there's so much on PubMed, right? You're like, oh my gosh, why haven't I been, why wasn't this on my radar for this long as a clinician? So it's very exciting. Makes use of all healthcare professionals and disciplines, team-based, and considers the mind, spirit, community, and body. And that's why it's team-based, because for all these different root causes, there's going to be all these different specialties that can come and help a person achieve their optimal health. Why do we need functional medicine? Prevalence of complex chronic diseases is escalating globally, and there's things in our clinic that we've helped clients with super complex diseases where they've gone to Mayo, other places, and just weren't getting answers that functional medicine was able to help them with. It's really incredible, and I think that just showcases the gap in medicine in the United States right now, and I'm sure other countries. Chronic diseases are often nutrition and lifestyle related diseases, require nutrition and lifestyle solutions. And this is part of why we're in this conundrum in the medical system right now, because we have this hierarchy, right? And these specialists, doctors are at the top here. But as I mentioned, on average, doctors in medical school have less than 20 hours of schooling in nutrition science. It's not their fault. It's just not a part of medical schooling. So then if we have this hierarchy trickle down, they don't even think like, oh, maybe I should refer to a dietitian or considering, nutrition-based approaches, because they've been even taught sometimes that nutrition can't help. Nutrition is not going to make a difference. So that's what we're working against, and I'm so grateful you all are here and expanding your knowledge. So the current healthcare system fails to consider the unique genetic makeup of each individual or the ability of food toxins and other environmental factors to influence gene expression, so epigenetics. It's not just our genes, it's how we can change our nutrition and lifestyle to change the expression of our genes, to make it just so we can live an enjoyable and healthy life. Medical costs are escalating, and the drive to drive these costs down, we need to focus on disease prevention and reversal. So I really like this video. I just pulled it in here and I'm going to play it for you.
Dietitians in Integrative and Functional Medicine, or Diphm, is a specialty practice group of the Academy of Nutrition and Dietetics. Registered dietitian nutritionists touch the lives of countless individuals in communities throughout the country and around the world. We passionately believe in a holistic, personalized approach to health and healing. We believe in tailoring treatments to address an individual's unique needs. Health is a positive vitality, not just the absence of disease. It's also about understanding the complexity of an individual. Everything from lifestyle, history, lab work, and physiology to factors like genetics and biomarkers. Diphm members are your partners in health and wellness. As dietitians in Integrative and Functional Medicine, we believe in the power of food as medicine. Healthy in equals healthy out. Food has the power to positively affect how we feel, how much energy we have, and even prevent, treat, and reverse many chronic illnesses. Educating on how and why certain foods optimize and transform health is central to our mission. We have a deep understanding of core imbalances within the body. With the right food and dietary supplements, we can better manage conditions like cardiovascular issues and Crohn's disease. We can fight inflammation and promote the harmonious balance of bacteria in our bodies. It's choosing a pomegranate over a prescription, and we help people understand the power of choice. Diphm connects the dots between mind, body, and spirit. We don't just ask about what you eat, how much you exercise, and your overall health history. We focus on your social and emotional connections too. Do you have a spiritual practice? Do you have positive and meaningful relationships in your life? Do you spend time in nature? Diphm champions the importance of not only feeding your body, but also feeding your mind and soul. Difhm's philosophy centers on the idea of registered dietitian nutritionists working in harmony with individuals and healthcare teams. We're known and recognized for our personalized nutrition services, but we're so much more. We're part of your community, improving the health of people everywhere, including underserved populations. We're working in community gardens, food banks, and child health programs. We guide individuals and communities in making changes to ensure the healthy choice is the easy choice. We work with business and industry, public health, government, and schools, influencing policy that promotes accessibility to healthy lifestyles for everyone. Diphm members stand out. Our integrative and functional nutrition approach sets us apart. Passion drives our belief that given the right tools, the body can heal itself. And the best way to treat people is to look at the complete picture of health. With our help and guidance as nutrition experts, individuals, communities, and organizations everywhere benefit from clarity, hope, and an appetite for health and wellness. We're inspired every day by their success stories. One registered dietitian nutritionist can change a person's life. Diphm can transform the way we all think about nutrition. We are dietitians in integrative and functional medicine, making the world a healthier place, one relationship at a time.
Right, and if you don't know, the Academy is this group for dietitians, kind of like a professional membership, and so Diphm is a subgroup of that, but I just like the message they're sending out in the video and helping to explain what functional medicine is, how functional medicine dietitians and practitioners differ. And because you might still hear people call it woo, I wanted to add this slide where Cleveland Clinic has a center for functional medicine that's really well known across the United States. This is one of the best hospitals in the country, and they've embraced functional medicine. So they're merging the functional and conventional worlds. And you can see on their website all these different conditions they can treat with functional medicine. They actually go ahead and use that word treat. So adrenal disorders, Alzheimer's, arthritis, asthma, autoimmune diseases, cancer prevention, cardiovascular, diabetes, digestive disorders, fibromyalgia, environmental and food allergies, women's health disorders, metabolic syndrome, prediabetes, insulin resistance, thyroid disorders. And let's hear a little video from Dr. Hyman about how functional differs from conventional, and then we're going to hop into those case studies.
In functional medicine, we deal with some of the most difficult patients, and we do it with pleasure because we know we can help these people. Patients we couldn't help before suddenly become exciting to see because we know we have a new roadmap, a new way of thinking to fix their problem. Like the little girl who came in a while back who had psoriasis from head to toe. She was 4 years old. She'd had problems since she was 6 months old. She was treated with TNF-alpha blockers, Imuran, steroids, multiple medications to suppress her immune system. In fact, she ended up in the ICU with MRSA and ended up needing a month of IV antibiotics just to prevent her from dying from the treatment that was supposed to treat her psoriasis. The patient was fed up. The parents were fed up. And she came to see me in my office, and we asked a very simple question, which is not what drug should I give you to suppress your immune system, but why is your immune system so aggravated in the first place? What is the cause of the inflammation? And we know in functional medicine there are a few triggers that trigger inflammation. It's allergens, it's microbes, it's toxins, it could be poor diet, stress, very few things we have to think about. So we went through the list and we figured in her case it was most likely what she was eating. And we know from the literature that gluten can trigger psoriasis. We know that yeast and gut dysbiosis and leaky gut can trigger psoriasis. So we focused on those things. We got her off the foods that were likely to be a trigger, gluten and dairy and a few other things. We gave her an antifungal to clear out the yeast from the months of antibiotics that she'd had. And we gave her some simple nutrients like zinc and fish oil and vitamin D to help repair her leaky gut and help her immune system function. And 3 weeks later, her father called me up after I saw her and said she was completely clear from head to toe. First time since she was 6 months old and she was 4 years old. Simply by getting rid of the bad stuff and putting in the good stuff and letting the body heal. And so that's the power of functional medicine. By treating the root cause, medicine by cause, not by symptom, we can see miracles.
Amazing, isn't it? So 3.5 years of having really severe skin issues, and then 3 months of functional medicine, and her body healed just by giving it the right tools. So that is the power we're talking about here. Okay, let's start with a case study of acid reflux. So the old way with conventional medicine would be, how do I treat the symptom, right? And then this new way with functional medicine, we're thinking, what's the root cause of the symptom and how do I treat that? So let's go ahead and move, we'll just kind of move these boxes. Medication management is the main one for acid reflux, right? Get them on a proton pump inhibitor, an H2 blocker. But the issue with that is those medications aren't meant to be used long term, and they can actually set somebody up for nutrient deficiencies like magnesium and zinc and vitamin B12. And a vitamin B12 deficiency long term can actually lead to brain damage, memory issues. So they could give temporary relief, but another concern is that people can get hooked on them. Their body can get hooked where it's hard to stop it. In order to taper off, you have to taper really slowly over a long amount of time and use some nutritional lifestyle interventions to help support that tapering process. So sometimes people, without knowing, they'll just say, oh, I don't want to be on this medication anymore. They stop it, they get rebound acid reflux. Even worse, they have to go back on it. So it can be a really negative cycle there. And then maybe people are told about some lifestyle diet modifications that help, like avoid acidic foods, like elevate your bed at night. But that's the main current conventional medicine way. So if we move over to functional medicine, we want to talk about and think about what's going on lower down in the gut. Is this person also having pretty intense bloating and gas, especially after eating? Like it's better in the morning, it gets worse after meals. Are they having any sort of abdominal pain? Have they had their gallbladder out at any point? And might all that be influencing the acid reflux? Might there be dysbiosis and an over-fermentation going on in the small intestine that could be leading to gas coming up and causing acid reflux? The stomach's supposed to be acidic, and could it be that this person's stomach isn't acidic enough, and it's causing the sphincter between the esophagus and the stomach to relax a little bit and give them this feeling of acid reflux? So, or might it be foods triggering? Maybe there's a couple foods that are causing acid reflux for this person, and if we can figure out what those are, they could avoid having to go on a medication. Maybe it's stress. Maybe this acid reflux came on when they're in a stressful period of their lives, and we can connect the dots, helping them as medical professionals with that. Maybe they're not sleeping as well because of the stress, all contributing to the acid reflux. So helping to support them with different techniques to decrease the chronic stress, maybe even using adaptogens like these herbs that could help the body adapt to stress while on that journey. So here's a story of a client of mine. Amy was struggling with acid reflux, GERD. She was on medication, and she came to me, worked with me on a nutrition plan. And as I had mentioned, we were able to work with her doctor to help her taper off the medication. And that was so exciting. It was only a couple months, if I remember right. We did some food and lifestyle adjustments prior to starting the taper. And again, the taper is just a really long taper over a couple months so that it would work and she wouldn't get rebound acid reflux. And now she's so thrilled she doesn't have to take that medication every day. Okay, let's move on to constipation. An old way with conventional medicine would be to say, eat more fiber, drink more fluids, and then maybe using some medication management. And there might be some, depending upon the clinician, there might be some added suggestions, right? But those are the main go-tos from my experience working in the conventional system. So then when we think about functional medicine, so much more that we can consider for possible root causes. Gut health. So is there maybe a dysbiosis, poor motility, low stomach acid, lack of gallbladder and or bile, lack of digestive enzymes, gastroparesis, maybe a methane dominant SIBO, maybe they're getting a ton of gas and bloat as well, maybe celiac, as mentioned. Celiac doesn't always just present with diarrhea. Sometimes celiac can present with just like headaches or just brain fog. So foods, yeah, maybe there is a lack of fiber, maybe that's it. But maybe there's also a sensitivity or an intolerance could be causing the constipation. Lifestyle, so sleep and stress and exercise. And if somebody's traveling a lot and their circadian rhythm's getting disrupted, that could be causing this constipation while they travel. Many of you maybe have had that experience where you go into a different time zone and maybe you don't have your daily bowel movement for a day or two because the body gets into this sync, this circadian rhythm, and usually the bowel movements are to happen in the morning when we're in this nice kind of sleep-wake rhythm. So getting back into a rhythm or creating a rhythm with a client can actually help constipation if they've never had one. Medications could cause, so there's this great website called Diphm, and you can type in all the medications. A doctor created this, and it'll show the research for possible side effects to different medications. And then supplements could be causing too, like iron's notorious for contributing to constipation, or activated charcoal, maybe spore probiotics. There might be a hormone imbalance contributing, like thyroid, and sometimes a full thyroid panel isn't checked, but sometimes we need that in order to get enough information to know if somebody might be having some thyroid issues before that TSH jumps up. And then we would, as a dietitian, we'd be working with doctors on those diagnoses, components. And then also, is there maybe pelvic floor dysfunction? Pardon the typo there. Maybe using some micronutrients. So often when I have a client come in with constipation, while we're thinking and working through all these possible root causes, I might start them with some gentle magnesium citrate, which is safe for most people and can help give them some quick relief while we work through the root causes. And it might just be a magnesium deficiency contributing to. Often there's multiple root causes for a person. And then using different tools like a squatty potty to get the body into better alignment when having a bowel movement can really help. So it's really unpeeling the onion is a great analogy. There's many possible root causes. You just have to start somewhere. Sometimes we'll use our intuition as clinicians as we read through the full intake form, see their history, see what they've tried already, haven't tried. And then maybe there's a couple options that would make sense, and we can kind of tune into our intuition, talk to the person, and see what would make the most sense as like a starting plan, weighing possible benefits, potential risks. Create that plan and then just learn from it and adjust as you go. It's really unpeeling that onion. So you have your first layer of your starting nutrition plan. How much does that improve and what symptoms? And then what should you adjust and add on from there? How's it working for the client? Maybe you're talking about some food changes and they're having some barriers to that. So are these barriers you can brainstorm a way to overcome, or is this plan maybe just not going to work for them and you have to create a new plan or adjust that? So move forward, peeling the onion to find root causes, and let's do your turn. So we're going to do this case study on headaches and migraines. I filled in the old way with conventional medicine, which is usually medication management, like tons of medication options that they'll cycle through. It's kind of similar to my acne story where it was just a different medication every few months. And there might be possible lifestyle suggestions that are discussed, like stress and sleep and fluids and exercise and a headache diary. But from what I've been told for most clients, they usually are, they don't have much time with the doctor. So usually it's like a medication is given to them. So the new way with functional medicine, and I know this is a recorded presentation, so we can't be interactive, unfortunately, but just start thinking, and I'll go through the list that I have here and see if maybe you thought of some of these things. And if you haven't, totally fine. This is what you're going to be learning going through this schooling program in functional medicine. And so ideas might be micronutrient deficiencies. So there's many that could contribute to headaches and migraines. A biggie that tends to help is magnesium. There's also riboflavin B2 is becoming more recognized by conventional doctors as well. Then there's also vitamin D and calcium. It could play a role. CoQ10, glutathione, folates, vitamin B12, vitamin C, lipoic acid, carnitine. And there's ways that we can test these things. There's companies that we can work with, like SpectraCell is a company that does micronutrient testing in the white blood cells. Genova is another company. And sleep. Might sleep be contributing to headaches, migraines? And this is where you will help to piece together the timeline and puzzle with a patient or client. Blood sugars. Is this person eating in a way where their blood sugars might be dipping often, or maybe it's the afternoon, they always get this terrible migraine? What are they eating at lunch would be a question. Acupuncture could help with headaches and migraines. Food sensitivities could be contributing, and there's different testing that we can do, like mediator release testing has been shown to help with lifelong migraines in people. I usually leave that more to last resort because it can be pretty food restrictive, but if somebody's has tried all these other things we're talking about and we're still really stuck and not getting resolution, that's a great option. There's little tools like mint could possibly help, like chewing on some mint when it comes about. Parasites could be a root cause. Glutamate imbalance, histamine intolerance, celiac disease again, mercury fever. Do they have a bunch of mercury fillings? And maybe did the headaches, migraines start after that? If they can think back and remember those connections. So I have a story for you on this. This is a client that came to me and had not had one migraine in 3 years after us using functional medicine to find root causes. And so basically she would get a migraine at least once a month. We're talking about the kind that makes it so you can't even move. We started with magnesium, like I mentioned. I love magnesium because it's so safe, it's so easy, it's cheap and affordable, and I've just had such great benefits. There's different types and forms of magnesium depending upon what you want to use it for, like meg citrate for constipation, meg glycinate for headaches in this case, and she hadn't had a migraine since. Not one migraine in 3 years after having them her entire adult life, is what it was. And so she also was experiencing bowel issues, caused her to miss a day of work per week, and we helped with those things as well. And I want to share this story also because it doesn't have to be a huge, big, complicated solution sometimes. Sometimes it's just these little tweaks that can make such a big difference in a client or patient's life. And you'll hear me say client, patient, and it's because every clinician kind of calls their clients something maybe different. What usually resonates with me is I'll say patient if I was like working in the hospital setting, was kind of the go-to name, but in a clinic, like at Oswald Digestive Clinic, I like to refer to them as clients. Okay, here's another cool one. Kate, this is another magnesium related one where she was having insomnia, and she was actually a nutrition intern at our clinic and was just telling me this story, and she was working on a project. She's like, Ash, I just need more time. I'm really not getting sleep. So I'm like, tell me what's going on. Long story short, I realized, she'd been taking birth control. She's in college in a really pretty competitive nutrition program. And I just thought, okay, let's just start with some gentle magnesium and see if this might help. And incredibly enough, it worked for her. Her insomnia where it was bad. She was not able to sleep for days on end. It went away with using magnesium. And she stopped taking it for a little while, and the insomnia started to come back. So just really, really incredible how some of these simple nutrition additions can be just so life-changing. I'm not going to play this one because it's longer, but I wanted to keep this slide in here because Yusuf talks about a few more case studies on functional medicine and how, the gut can be the center for some of these autoimmune issues. So if you want to hear some more little cases, I would suggest just pulling this up on YouTube. That's exactly the name of it on YouTube. And we are going to jump into some useful clinician tools. There are many. I'm just going to give you a little taste and share some of the main ones that we use. And so this is our comprehensive intake form. This is really key because when clients come in, I want to know a good amount of their history because that's what makes me a good clinician, is hearing what they've tried before, what's worked, what hasn't worked, what have you been diagnosed with, what are all the symptoms you have, because I need to know all those different symptoms so I can really piece together the puzzle. If somebody's coming into me and they're like, oh, I have headaches, can you help me? I need to know everything else. How's your gut? How's your sleep? How's your, XYZ? So our intake form takes clients about an hour to fill out, and I just kind of screen recorded it here. This is what it looks like on the back end of our electronic health records. You can see the edit, copy, delete. Clients don't see that, but I wanted to show you this side because you can see that we can adjust this based upon the type of clinic we have too. So if you have like an eating disorder clinic, you might want to adjust some of these questions compared to like our digestive health clinic. And then on the client side, it comes up really nice, clean, all electronic for them to fill out. And then we use some different assessment tools like the stool chart too, the Bristol stool chart, just super easy to track to help people share with us what's going on because it's a tool. It's all these are like little snippets of information that we can then piece together, and what the stool looks like can give us some really good information. Is it like overly odorous and floating? Maybe there's some fat malabsorption going on if that's the case. And then of course type 1 up here would be leaning way more to constipation, and we already talked about where we would go from there then. So ideal would be number 3 and 4 here. In Chinese medicine, they say that stool should look like a snake, like coil up in the bowl, sinking, this brown color. And even the color of stool, I don't have that in this presentation, but that can give us information as well. So there's a colon transit time form. We usually use this, we use it in our course, sometimes with clients, but basically showing how long it takes food to go through the gut, and you can kind of read more about that if you're interested. This is the one we use a lot in our clinic, so symptom tracker. I love this one because it's a great way to track outcomes. Traditionally, with dietitians, we track weight and like BMI and stuff. And in functional medicine, that just doesn't make sense. I mean, it doesn't even make sense in conventional medicine in many ways. This makes so much more sense because it's such a more holistic view of how much the client's improving, and you can even do it by different categories. Like, so we track the digestive tract category as a number and then the grand total number, and you'll see later on I have some examples of what we pull that to look like, and actually I can hop there right now. So this was a social media post one of our interns created for us, and it just shows the before and after in 3 months, like how incredible she was able to go from 195 to 33. And it's not always like a straight road. Sometimes clients get significantly better, then maybe something happens and the symptoms come back a bit, and you have to like support them and figuring out why. And so it's kind of like entrepreneurship in some ways, but overall we would hope that symptoms just slowly go down. And sometimes it's a matter of like 3 months, we cut out certain foods where it got significantly better, but then it's the question of, okay, how can we try to get this person's gut to improve so that she can actually tolerate a lot more foods again? I had a client once who came to me eating 10 foods, and she almost didn't come on board because she had, paid a lot of money out of pocket trying to work with other clinicians as well to get some answers. And we've been working together for a few years now, and there's probably 10 foods she can't eat now. So what a really exciting flip. And she was only eating 10 foods because if she ate anything more, her gut issues would come back, her symptoms would come back. So that's a big component to all this. All right, then the last slide I have here on other tools are an electronic health record. Just makes all the sense in the world for organizing client information, disease-specific questionnaires that we have inside of our EHR, just some like policy consents, HIPAA agreement if you're doing insurance, release of medical information form. And then this one I get asked about a lot. I'm a very organized person, and people are like pretty surprised usually when I can pull up information so easily, and it's because of how organized I am. So I want to give you this little tidbit. I think it'll be especially helpful going through this program. You can use iCloud organization to organize into different categories like this, so it's really easy to search. And then you could type stuff into Word documents that are searchable. So I'll do like I have a Word document that's thousands of pages now, I would guess, And there's different sections like constipation, and I'll just put an asterisk constipation for the constipation section. So then when I'm searching, I just put asterisk constipation, brings me right there, has all this information, because honestly, this functional medicine, there's just so much. You're not going to just have it at the forefront of your memory always. It's the trick of knowing where to find information. And so here's a picture of what my iCloud looks like. And you can see this is only like the A's and B's, so it goes all the way down to C. But so if I had a client coming in with, anxiety, I can pull that up, and then it would be like tons of folders in that folder with all my anxiety content that I've gathered over the years. So I hope this is helpful. And then let's talk about some client stories to get you more excited too for becoming a functional medicine practitioner, or if you already are one, for continuing your education in it. So Mark was a client that came to me struggling with gas, bloat, diarrhea for years. He had his initial consult, created a nutrition plan, and after just 2 weeks, he had 90% improvement in gut symptoms that he had for years. This is one of those cases where we made food modifications, which is why he got so much better in such a short amount of time. But then it's really the art of going a step further and getting his gut to tolerate those food intolerances again. So we did little FODMAPs for 2 weeks, and this was when I was working in California, and he didn't say a single word to me for 2 weeks. He just came into his appointment. He's like, yeah, my symptoms are gone. I'm like, what? Your extreme gas and bloat and diarrhea that has been affecting your life and your family for like years is just gone. And so it was really fun to see. And then Sandy was she's more recent, a really cool story where she was struggling with severe anxiety for years. She couldn't even leave the house to even go grocery shopping some days. And so we tried functional medicine. We did some micronutrient testing. She was eating really pretty whole real foods already. And the one food related thing is she was a vegetarian for many years. So we did talk about adding in some meat, because for different reasons, I felt like her body needed it. And then we also did micronutrient testing, and a lot of her micronutrients that came back low and deficient were actually ones that could contribute to anxiety. So we replaced those with megadoses for like 4 or 6 months. And she's one of the least anxious people I know now. I mean, she was incorporating also meditation and yoga and going for a walk and keeping those at the forefront. But I really think it was the nutrition components that made so much of a difference. And when it comes to that meat component, I want to share a brief story of another client who's also vegetarian, and she started adding in grass-fed beef sticks a couple times a week, and she had severe depression on and off over the course of her life. And she calls the beef sticks her short-term antidepressant. Like, she notices her mood improves that much over the course of a few hours of eating that. And she totally has to eat it like medicine. Like, she does not want to be eating meat, which I get. I was a vegetarian for 6-7 years as well. But she does it because she realizes, like, actually my body as a young female, and there's something in it that helps me, that makes me feel better. Which is where some intuitive eating practices can come in and join with all this functional medicine stuff, like teaching clients how to listen to their bodies. And as you go through creating a functional medicine plan, teaching them how to like listen and pick out what might be causing what, right? And then this one is I wanted to add because it was her son that I was seeing, and basically with what we were doing with her son, kind of transitioning to just mostly eating real whole foods. They were just eating a lot of sugars, a lot of carbs. This 12-year-old got prediabetes, and this by effect is that by her switching to support her son, she noticed that she lost weight, and says it wasn't by restricting or counting calories, but by switching to better food selection. So I wanted to share this because I want you to see that even just working with clients can have a ripple effect in our communities in a really positive way using food as medicine. So I already talked about that one. And then here's a really cool story. This is the last one where We just took a vacation for the first time. I didn't feel sick the whole time. So a gut health client, all because I changed the way I eat. I no longer spit up after I eat. I no longer have stomach cramps all day and ones that keep me up at night. TMI, I'm finally regular is what she said. And we just took a vacation. For the first time, I didn't feel sick the whole time. I don't stress out wondering where the bathroom is when out of town. I no longer have to run daily to worry about my weight. So that's, the power of functional medicine. So next steps, some potential barriers to functional medicine would include insurance reimbursement. So it really depends upon the type of provider somebody is. Patient time with a practitioner, that might tie in with insurance reimbursement. Maybe overwork with practitioners, like limited energy and different roles. Like if it's a doctor seeing 30 patients a day, it's difficult to talk about nutrition and lifestyle. But what's important is, like I said, about the teamwork. And they could refer to like a dietitian. Like our clinic, we can have 60 to 75 minutes with a client, and some of our clients get full insurance reimbursement, and it works out for us as dietitians. The biomedical model, like treatment-based, not preventative. So this is that whole flip, right? Root causes. Misunderstandings of functional medicine amongst practitioners, lack of well-trained professionals, so thanks for being here, and then lack of client and patient receptivity. So this video is just kind of like an encouraging one about us working together to unbreak healthcare. And ZDog MD, he has some fun like music videos he's created. So I'll let you pull that one up on YouTube if you want to listen. So we must start together. We must just start somewhere. And if you want to stay in touch, here's some information about me. I should have changed this because, of course, we're not live, but this is going to probably be on YouTube, so you can just ask away below the video, and I'd love to answer. If you know of anybody who wants to work with our clinic, they can schedule their first appointment here. We're accepting these insurances. On YouTube for more information, TikTok, we have a masterclass, a download. This one's actually might be really great for you as you learn more about functional medicine and these different categories that can be considered when working with a client for gut health. And then here is just our website. So thank you, everybody. It's been a joy, a pleasure getting to share this information with you, and hopefully I'll get to chat with you again soon. So hope you're having a great day. Bye.